clinical examination of the central nervous system, the diagnosis of brain death. So modern life support techniques and the use of organs for transplantation make it essential that rigid criteria exist for the diagnosis of brain death. To consider brain death, the following conditions should be fulfilled and should exist concurrently. The patient should be deeply comatose. Inherent in this condition is the absence of any depressant drugs in the circulation, such as narcotics, tranquilizers, and hypnotics. And also, primary hypothermia should be excluded. And metabolic and endocrine causes for coma should have been excluded too. The patient should be of necessity maintained on a ventilator because of previous inadequacy or cessation of respiration. And thirdly, a firm diagnosis of irremediable brain damage should have been established. So, consequent upon these conditions being fulfilled, the following tests, which require confirmation after an appropriate interval, which might be as long as 24 hours, are required for definitive diagnosis of brain death. And all brainstem reflexes should be absent. And this is accepted if, firstly, the pupils are dilated and not responding to light. Secondly, vestibular ocular reflexes, as caloric reflexes, are absent, and these may be tested by irrigating each external auditory meatus in turn. This will be done with 20 milliliters of ice cold water, and ensure that care has been taken to establish that tympanic membranes are intact and the external auditory canals are unobstructed. The reflexes are absent with no eye movements occurring. Okay, thirdly, corneal reflexes are absent. Next, there are no motor responses within the cranial nerve distribution after adequate stimulation of any somatic area. Next, there is loss of gag and bronchial stimulation reflexes. And lastly, there is no respiratory movement after disconnection from the respiratory systems ventilator or ventilation for a sufficiently long period to allow PaCO2 to reach 6.7 kPa, that's around 50 millimeters mercury. It is important to remember that spinal reflexes may persist after brain death, and that electroencephalography is not necessary to diagnose brain death.